Good evening, sir. Greetings from East Coast Hospital.
Thank you.
And tell me about yourself, sir.
Uh, I am Dr. Neelesh Shrivastava, and I am working as a consultant surgical oncologist in our East Coast Hospital. And my OPD visiting time is from evening 5 to 8 p.m.
Thank you, sir. And we are happy to hear about from you a lot of things. So, first question, what is cancer, sir?
Generally, there are pupils they are having myth regarding the carcinoma. Like once they will learn and once they will listen about the carcinoma, they will think that it is incurable. Cancer, you can tell like it is a growth of cells which in which that body is not body cells are not able to control their growth. So they will grow according to the time, and once they will reach the barrier, they will spread to the whole of the body. So it is a growth of the cells which initially start from a one side, and then slowly it is spread from one side to the other sides of the body. So basically this is called a carcinoma. It can be a lump, it can be a swelling, it can be a ulcer also.
Why people fear cancer, sir?
As I already told that because there is myth in community, they are having myth like if cancer is there, it is untreatable, it is incurable. If you are having carcinoma, you will definitely going for death. Like that, these myths only patients are facing, and due to this myths only, they are having fear for the carcinoma. But this is not true.
Okay, sir. Which cancer will behave in a good way and which cancer will behave in a bad way, sir?
So see, there are much more varieties of carcinoma is there in the body. Almost every system it can happen from the head to toe, starting from your skull to your toenails. Okay, but if you are asking for prognosis, if you are asking which carcinoma is behaving in a good way, you can tell like if patient is having breast carcinoma, especially in females, they are having a good prognosis if it is detected in early stage. Even patients who are having melanoma, which detect in early stage carcinoma, they are having good prognosis. Patients who are having early esophageal carcinoma, early GIT carcinoma, early gastric carcinoma, the early soft tissue sarcoma, these are patients, early thyroid carcinoma, these are patients are behaving in a good way. Some carcinoma is there which are behaving in a bad way. Even if it is an early stage, they will behave in a bad way. Like if you are going for pancreatic carcinoma, even if it is an early stage, that we are not able to predict it how it will go in future. Okay, so some carcinomas is having good prognosis, some carcinomas is having bad prognosis. Especially in GIT carcinoma, it is comparatively bad.
Is there any way to detect cancer at the earlier stage, sir?
Yes, definitely there are much more ways there. By that you can detect the carcinoma in early stage. Like suppose if any breast cancer is there, you can go for breast self-examination. You can go for yearly clinical examination by an expert surgical oncologist, and either you can go for yearly mammography. Suppose for GI carcinoma, if you are having any symptom, best to visit your consultant and go for early endoscopy. So there is much more ways there. Like if cervical carcinoma is there, you can get pap smear or speculum examination, and early stage you can identify the carcinoma. So screening is the way. Already it is proven for breast carcinoma, for cervical carcinoma. So in these carcinoma, there is early detection is possible.
How to prevent ourselves from cancer?
So now we can tell that in the modern lifestyle, we are having a different lifestyle compared to the previous lifestyle. Now due to modernizations, there is sedentary lifestyle is there. Your dietary habits is changing. Like now too much junk foods is there. With that exposure to the environment pollution is there. You do not know what thing you are eating is that is having any toxic substance or not. Your daily routine activities, these all things which are in favor of increasing the carcinoma. Like patients are having people are having addictions also. They are having tobacco chewing, like smoking, like alcohol drinking. These all things are prone for carcinoma. So once you will change all of your these habits, if you stop the smoking, if you are stop to taking the alcohol, if you are stop to chewing betel nuts, if you are walking daily, if you are having at least 30 minutes for walking, if you are having a good lifestyle, definitely it will prevent for development of a.
Thank you so much for your useful information, sir. We wish people will get cured from cancer and get detected at the earliest. Thank you so much.
Thank you.